right. Thank you everyone for joining us this evening, I should say, to learn a little bit more about nursing at Lakehead and what makes it exceptional and unconventional. We have a few faculty members from the nursing program. One of them will be joining us shortly. I'm going to do a quick introduction to begin, and then you can hear directly from them about the nursing program, and you'll have a chance to ask as many questions as you like. Erin will be monitoring the chat as we go through, and there'll be a Q&A session at the end. So we're really excited to welcome you this evening to our webinar. For those of you who haven't used Zoom before, there's a Q&A section that you can type in your questions and have Erin answer them during the webinar. You can also connect your audio, or you can just chat your questions if that's working. So my name is Quinn. I'm a recruitment advisor at Lakehead University. I was a business student at the Thunder Bay campus and now live in Aurelia. So I'm super happy that you're joining us. And I will pass it on to my colleague, Erin.
Hi, everyone. So as Quinn mentioned, my name is Erin. I am also an alumna of Lakehead, but from a different program. I'm also based in Thunder Bay, born and raised in Thunder Bay. So I'm happy to, in the chat, if you have any questions about Thunder Bay, I can definitely answer them along the way. But as Quinn mentioned as well, I'll be behind the scenes answering questions, marking them to be asked live for our faculty to ask as well. So feel free at any point to ask questions. And as Quinn mentioned, we will have a question and answer period at the end.
Awesome. Thank you, Erin. And finally, our esteemed guests. We have Catherine and Caroline. So Caroline will be joining us shortly. And yeah, there you are.
Hello. Thanks for coming tonight, guys. My name's Caroline. So I'm the Sim Lab coordinator in the School of Nursing. I'm a graduate from the Compressed program, and I worked previously in the ICU at Thunder Bay Regional. So before I started my job over at Lakehead about a year and a half ago. So that's my past. And then we'll have Catherine as well. She is a professor, an assistant professor in the School of Nursing, and she will be joining us shortly.
Awesome. Thank you very much. All right. So just a quick introduction about Lakehead. So we're among Canada's top 10 primarily undergraduate universities. We have a really big focus on undergraduate research. We're number 2 in Canada for the undergraduate research opportunities our students get. And we do have small class sizes. So 90% of your classes at Lakehead will be fewer than 60 students. We also have a lot of financial aid to provide, where we give $11 million in scholarships and bursaries away each year to students, and we only have 8,500 students. So that makes us among the top in the country for the amount of financial aid we do provide. We have over 65 different programs, nursing being one of them, and our graduates have a wonderful employment rate with 97.7% of our graduates being employed in their field of study within 2 years of graduation across all programs, which is higher than the Ontario average. Here. And so here we have nursing, which is one of our most popular programs, and one we'll go into great depth this evening about. So thank you for joining us. And without further ado, let's get started. I'll pass it over to Caroline from here.
Okay, so we'll just jump right into the slides, I think, Quinn, and then we'll go from there. So here we have a couple of photos to start with. Okay, perfect. Thank you. Okay, so nursing is the program that we're here to talk about tonight. So nursing is, of course, a profession that blends science with caring and technology with humanity. So a science piece, but also a lot of the caring, communication, hands-on work, which is great, which we all love. Relational practice is the foundation of our curriculum. And throughout the program, you'll see 3 different components. So of course, we'll have the classes, lectures like you would in any other program. So the theory portion, we call that. And then that's paired with lab and simulation. So we have labs for skills, labs for assessments, and then we also have simulation labs. So simulation labs are where we practice throughout the program at different years of the program. We have different sims that are incorporated into those years. And we practice hands-on with a mannequin that has breath sounds, that talks, and we simulate a real life clinical situation to get you guys prepared for a hospital clinical. So then finally, we also have clinical. So all the way throughout the program, we offer clinical each year, starting first year winter. So that's pretty exciting. Not many other schools start clinical that early. So that's a big thing that sets us out from other universities. And then you'll also have clinical throughout the remainder of the program. And your final year of the program is actually broken down into 4 6-week blocks. So one of those 4 blocks is a theory, like the theory class component, and then the other 3 6-week blocks are actually all clinical. So lots of good opportunity to get that good hands-on experience and learning. Okay, next slide, Quinn. Perfect. So our program is delivered in 2 different options. We have a 4-year option and a 3-year option. So the 4-year option is the traditional delivery. It's over 4 years. You start in September, like every other program, and you have your summers off. So you go from September till the end of April, and then you're off May, June, July, and August. You continue that on for the full 4 years, and you're finished at the end of April, and then you're done, you're graduated. So the summer off is the biggest piece, the biggest difference, and it's the workload is spread out over the 4 years. Then we have the 3-year compressed program. So you end up with the exact same degree. You're graduate the exact same way as everybody else, but you go through the summers to finish quicker. So year 1, you would start in September, you go all the way till April, at which point you might have a couple of summer electives, or if you've transferred from a different program and you have electives that you're eligible to use towards your nursing electives, then you can use those and you perhaps could have that summer off. Then you start September of year 2, and you would have same thing. You go from September till April. Then you have about a weekend off. So, you know, not a whole lot of a break, and you jump right into 3rd year. So your 3rd year is actually over that summer. So you go from May until the end of July, at which point you've completed year 3. So it's pretty heavy, pretty full time during that year, but you get the whole year done in a pretty short, condensed time frame, hence the name compressed program. And then you would start back up in September of what would be your 3rd year, and you go until April, and then you graduate just like everybody else. So that's just to speak to the differences between the 2 program deliveries. Okay, next slide. We'll pass this off to Catherine.
Hi everyone, my name is Catherine and I'm a faculty member in the School of Nursing. So next on our agenda here is the strategic plan. So this is just a bit of an overview of our mission, vision, and values in the School of Nursing. So some of the things that we're working on over the next few years. So that's just for reference. And next slide. So some of our strategic goals within that plan are nurturing our partnerships, especially with our practice settings. Of course, the hospitals in Thunder Bay are some of our partners, but we have other ones as well in the community. So we certainly rely on those organizations for clinical placements for our students from years 1 to 4, and in the region as well. So some of our partners are actually beyond Thunder Bay, and students do placement in a variety of different areas. And then you'll see there are a few other different strategic goals that we're working on ourselves as a faculty and with our curriculum and with some of our collaborations across the broader university and in the community. Next slide. So these are our admission requirements. So you can see these as well on the website and in the view book. So these are the expectations that we have of students coming into the nursing program or applying to the nursing program for them to be eligible for admission. So those are listed there. Next slide. Okay, so in first year, of course, the classes run through the fall and winter terms. So some of those courses are year long and some of them are just one term in duration. And the students start clinical in the winter term of first year, which makes our nursing program at Lakehead unique compared to some others, that they start clinical in the first year. Other schools of nursing sometimes run the theory really concentrated in those first couple of years and the clinical more in the last couple of years. So we do pride ourselves on having clinical integrated throughout all of the years. And students find that's very helpful with their learning to start clinical in first year. Next slide. Okay, so in second year, students focus a little bit more on clinical. Each year is a bit more of a focus on clinical and a bit of a step away from theory as they start to get that base knowledge and have opportunities to practice in a variety of areas. So in second year, students are mostly placed in medical and surgical areas to work on their application of their assessment skills. And they're starting with things like medication administration and various other skills that they learn at the beginning of fall term in year 2, and then have lots of opportunities to apply those throughout the year. And next slide. And in third year, students focus on various specialty areas. So in older adult, mental health, paediatrics, and obstetrics. So we do our best to make sure that students across the years have exposure to a variety of clinical areas so that students can see where they might like to work and kind of try everything on to see what suits their interests and their personalities the best. So we do try to do that, like I say in the previous slide, starting in med-surg in year 2, and then moving into these specialties in year 3 to try and give them the whole picture. And these specialty courses are paired with theory courses throughout the third year so that students can learn the knowledge and theory pieces that go with all of these specialized clinical areas. Next slide. So in fourth year, every academic term is 12 weeks long. And in fourth year, we divide those two 12-week blocks into 6-week blocks. So fourth year is comprised of 4 6-week blocks, 3 of which are clinical. So 75% of that final year is clinical and 25% is theory. Those clinical placements students can do outside of Thunder Bay for a couple of them if they wish. One of those needs to be within Northwestern Ontario, so it could be in the region, and the other placement can be even abroad if they wish. Of course, COVID sort of restricted our ability to have the students do international placements, but we hope to be getting back to that next year. So students coming into the program, hopefully things will be back to normal for them. So students might be coming to Lakehead from another city, another part of Canada, for example, or international students. So this gives them a chance to do a placement sometimes closer to home than a school that is closer to home. So that's a nice thing as far as our access to some of those placements for students, and that can really translate to employment opportunities for them. It gives them a chance to sometimes work in the hospital or a practice setting that they hope to work in after graduation. So that's something that's kind of unique about our program as well, because some other programs don't have the ability to do that, to give them that freedom of choice and to let them go for placement in other areas. And we have some scholarships for those international placements in year 4 as well. Okay, so lab experiences. I'll pass that back to Caroline. She's our lab expert.
Thank you. Okay, so like Catherine and I have talked about with the lab experiences early on in the program, so fall of year 1, you're coming in the lab, you wear your scrubs, we're starting to get you guys prepared for clinical right from the first your first semester of nursing school. So that first year of labs will focus on assessment labs as well as skills labs. So all the way throughout the year, you'll have weekly labs until April, at which point when you pick back up in year 2, like Catherine said, you're working on a little bit of those advanced skills that you don't learn in year 1, and that prepares you for your first medical surgical placement in year 2. So quite a lot of lab experience. And then sprinkled throughout the program, we do have those sim labs like I was talking about earlier. So we essentially mimic like a hospital environment. We have our sim lab, which looks like a patient room. You're giving medications, you're practicing different skills, and everything's kind of on the fly. So it's as if it's a real clinical experience, and you have to do what you would do in clinical, and we teach that and we practice that. So that's what the sim lab is all about. I think next slide. And then there's practice lab too. So throughout the years, we have a set date every week with specialized time with one-on-one with the lab instructor that you can drop into and come and practice your skills additionally if you felt that you needed a little bit more practice. So here are some photos that you can see of the sim lab. So we have our mannequin, we have a patient monitor up on the wall behind the mannequin. You can see to the right of those students, their med carts, so we're giving medications. You're working in a group too, so it's a really good group learning environment. And you'll see this sprinkled throughout the years of the program. So year 2, year 3, and year 4, students come into the sim lab to practice. Next slide, Quinn. Thank you. So this is a photo of the grounds of the Thunder Bay Regional, the outside of it. So this is located very conveniently right across the street from Lakehead University, so very close. And then our next slide will be St. Joseph's Hospital or St. Joseph's Care Group, which is another rehab center that students go to for clinical as well. Next slide, please. So that's a photo of St. Joe's. Okay, next slide. I'll pass this back off to Catherine.
Okay, so students at the end of any Bachelor of Science in Nursing program have to write a licensing exam to become registered nurses. So until that time, they are just people with a university degree that is a Bachelor of Science in Nursing degree. But to gain employment as a registered nurse, they have to write the NCLEX, which is a national licensing exam. So this exam came in about 6 years ago now as the entry to practice exam for students. So there's lots of good resources out there to support them in preparing for this. And of course, our curriculum is designed to prepare them for this exam as well. And students write a HESI exam, which is like a mock practice version of the NCLEX exam, and they write that in the fall term of 4th year. So that is how they become credentialed as a registered nurse. And that happens at the end of their time when they are also applying for whichever college of nurses they hope to work for. So for example, in Ontario, that would be the College of Nurses of Ontario. Next slide. So there's various student supports at Lakehead, and we promote these to our students, especially in first year when they're transitioning to university. So we do have guest presentations in first year, especially from some of these support services offered by Lakehead. So there's a list of a few of them there. And of course, our Lakehead website has more information about each of those as well. Next slide. So why choose Lakehead? So there's certainly a few reasons, at least we think, of course, that make Lakehead a special experience and unique from some other schools of nursing. And some of them we've talked about in this presentation. So one of them is that we have clinical in first year and spread out across all of the years. And our effort to make sure students have exposure to a variety of different areas to prepare them for practice and also to give them the bigger picture of all the many areas that nurses work. Another reason would be that our curriculum is designed with a foundation in relational practice, so working with people. And that shows our value in the School of Nursing of relational practice, and that's our platform for sure. So preparing the students to see the opportunities that they have as a nurse to develop relationships with people and also to develop themselves as people. So that's certainly a focus across our curriculum, especially in first year. Students having that opportunity to do placement outside of Thunder Bay, so in the region at a rural hospital or across Canada, maybe closer to home if they're from somewhere outside of Thunder Bay, and also to do placements internationally or abroad. So those are some other things that set us apart from some other nursing programs for sure. And we have certainly made good use of the technology around simulation, like Caroline was talking about with lab experiences. So we are very well set up and established with how labs are integrated in our clinical courses and lab courses across the program. So those are a few of the highlights for sure. And of course, we hope to have a few questions to answer in the question period. Is that where we're at with this? Do we have a next slide or are we on to questions? Wonderful, perfect. So one question that I've seen come in so far, I'll maybe start with that one, is a question about medical school. So some students, just like any undergrad, some students come into their BSCN with the intention of doing further education. So sometimes that's within nursing and sometimes that's in healthcare and sometimes it's something entirely different. So just like any undergrad, a Bachelor of Science in Nursing can be sort of a stepping stone or the beginning of your education that may go on to other things. So Caroline, for example, is doing her master's right now. So she's in our master's nursing program in advanced nursing practice at Lakehead. So some students go on to do a master's, some students go on to do nurse practitioners, and some students do apply to medical school after nursing. The advice I would give for that is to make sure that you're looking at the admission requirements of multiple medical schools, because only a small handful will consider nursing an appropriate prerequisite for their admission criteria to medical school. So if that is your dream and your ultimate goal, make sure you're taking an undergraduate program that opens doors for you for more than one or two medical schools, just to give yourself the best chance at admissions for that, if that's your long-term goal. So that's my advice for that. It's not that some nursing students don't go on to medical school, for example, at NOSM, the Northern Ontario School of Medicine, but if that is your ultimate plan, look at some undergraduate degrees that meet the admission criteria of most or all medical schools to make sure you keep as many doors open as possible. Okay, let's see, lots of wonderful questions here.
Yeah, there's a couple more that have come in. One
Sure,
of them
go ahead,
here, sorry, one of them here is, how many clinical hours total does the program offer?
Ooh, that's a good question. I'd have to do some math on that one. Who's asking that wonderful question? Oh yeah, I see. Okay, good. You know what? I'd have to ask you to follow up with an email to me, and maybe I'll put my email in the chat or send to you directly, and I'll have to do a little bit of digging to get you that actual number. But I can say that our number of clinical hours is significantly above the requirement that is set for us from the Canadian Association of Schools of Nursing, so our accrediting body. We do go above and beyond the number of clinical hours that is required for an accredited nursing program. So that I can tell you, and we have a good variety within that. But the actual number, I don't know that offhand. I'd have to do a little bit of digging for that. But that's a wonderful question. And it's a good question to ask as you're comparing nursing programs for sure, especially if you want to make sure one has a lot of clinical hours, and that's a good thing to look for.
Definitely. The other question here is, how far might you be required to travel for a placement?
So we don't require students to travel outside of Thunder Bay for any placements. So that's not a requirement of our program, is that you accept the fact that you'll be traveling. Students might be going across the street, like Caroline said, to Thunder Bay Regional Health Sciences Center, which is our primary practice setting for placements. It is literally across the street. You can see it from the School of Nursing. And then the other site, St. Joseph's Care Group, that some students have placement at, and certainly the other areas in Thunder Bay, you wouldn't be driving more than, say, 15 minutes to any of those places.
Perfect. The next question that we have here is, could you please touch on elective opportunities students who take nursing can have?
Okay, so with electives, you can take whatever you want. So we don't put any parameters on the elective. Some students choose to do a minor in something. So they'll do the base number of electives plus a few extra courses, or maybe they're coming into nursing with, say, a year of psych or a year of kin or something like that under their belt. So some students will do a minor in, say, psychology or gerontology or something like that, but we don't dictate at all what area the electives must be in. So we encourage students to explore their areas of interest or curiosity with those electives, but we don't put any parameters on that. Good question.
So another question here is, which science subjects are covered in nursing school?
Okay, so in the nursing curriculum, most of our courses are pure nursing courses. Students dabble a little bit with one course in psychology, a little bit with one course in math, and then the science courses, we have made them a nursing spin. So they are all nursing courses. So even our integrated biology and our anatomy and physiology courses aren't hosted by biology, for example, they're hosted by and delivered by nursing. So that allows us to twist the biology, chemistry sort of content into pharmaceuticals, and it allows us to twist the anatomy and physiology into physical assessment. So we can make those topics very nursing focused and even pair them with labs that prepare students to care for patients.
Perfect. So another question here, there's lots of questions coming in. Overall, what do you recommend, the 4-year program or compressed from personal experience?
So you've got one of each of us here, because I did the 4-year program and Caroline did the 3-year program, you know, each ourselves in preparing to become nurses. So one thing I will note is that the 4-year track is more popular for students coming straight out of high school, because that heavy workload of university can be a lot. But a student who's really strong academically coming out of high school will hopefully stay strong academically in university and can probably in most cases handle the compressed workload, but it is extra. So you're carrying approximately about a half credit per term on average, most terms extra above the course load of a university student. So that's one thing. And that second summer between years 2 and 3 of your 3-year compressed program, you have to stay with us most of that summer. So if you're from out of town, you don't have that same big chunk of time in the usually long summer to go back home. So that's another thing to think about, just as far as life and balance and family and relationships and those kinds of things. So that's a little bit there. Caroline, anything you want to add to that?
Yeah, sure. So one thing to note, you do need to apply to both. So you can't just apply to the compressed and then try, switch into the 4-year program. So you apply to the 4-year and the 3-year right from the start. So it would be 2 of your 3 selections on the application. So that's important to note that's not always as clear as it could be. So apply to both if you're interested in one or the other, or if you're not quite sure about which you'd be interested in. And like Catherine said, yeah, certainly we see more students straight out of high school in the four-year program. So definitely you have to just kind of do a little bit of self-reflection and decide if you're willing to give up that extra time and if you can put in the effort to that extra half credit, because that is it is a heavier workload certainly, but it's manageable and lots of people do it. So self-reflect and think what meets your goals and fits best with your lifestyle, I would say. I think that's all I have to add.
And the three-year
program, it was good.
The compressed track can be a good option for a student who has maybe a year of previous university education, or maybe even a whole degree, and they have some transfer credit, maybe for one or two of their courses and maybe for their electives. So that can be a good kind of student to apply to the compressed three-year track, is someone who has a bit of university under their belt already and has some courses that'll transfer for electives at least.
Awesome. So a few more questions here. How many students are admitted into the collaborative program and the compressed program each year, if either of you maybe know that answer?
Sure. So that number is a little bit of a moving target, but on the whole, in the compressed track, we accept about 90 or 90 some students. And in the collaborative track, the four-year track, approximately 120 students. So the four-year track, about 120, and then the three-year compressed track, about 90. Bit of a moving target though, so those numbers change a bit sometimes, but that's the big picture there.
Thank you. Another one here. In your opinion, do the simulation labs create a realistic environment that you'd find in hospitals and clinics or other settings?
So the sim labs are wonderful. Every student that walks away feels like they've just been able to really put it together. And the beautiful thing about sim is that no matter what mistake you make, no one's going to be hurt because of it. And you can learn from those mistakes. So certainly with all of our fairly advanced technology, we've got 2 sim mannequins that, like I said, breathe, you can auscultate heart sounds, you can palpate their pulses, the patient talks to you, communicates, you can check their pupils, all these different things. And we have a really high-tech software that we run the sim man through. So we have really good technology. And then the purpose is to practice those higher stakes situations. So like a code blue, we run a code blue sim. We run an end of life type simulation, palliative care, and then we ran some med surge sims. So a unit, it would be from the perspective of a patient on a medical or a surgical unit. So running through that, like a post-op type patient. And then in third year with the specialties, we have sims that go along with that. So lots of opportunities to practice those situations that you just don't see as much in clinical, or that are a little bit more challenging when you do come across them. So yeah, the students love sim. Everybody always has really good feedback.
So another question here. So someone's asking about the minors. Do you know any specific minors that students have pursued while in the nursing program?
I know some students have done, say, psychology or gerontology for a minor, but the number of electives that we have as part of the nursing program, it's not enough to get you the minor. So you'd have to top that up a little bit, either by having some of those courses under your belt before you come into nursing, or by maybe carrying a bit of an extra workload or doing some additional courses during the spring summer terms. So the number of electives required just isn't quite enough to give you that minor, but it's a start. And if you keep them all concentrated in the same area and top that up a little bit, you could get a minor by the time you graduate.
Perfect. And I do have another question that came in. Just a little bit of confusion around applying to both of those programs. We just have someone asking, do you need to apply to both 4-year and compressed, or can you only choose the 4-year program?
Yeah, you can absolutely only choose the 4-year program. Yeah. So Caroline was saying earlier, if you're interested in both, it counts as 2 separate applications, but many students just apply for the one they're most interested in. So absolutely, you can just apply for, say, the 4-year track. That's what I did a million years ago, just applied for the 4-year track. So some students, if they're really absolutely sure they want to go to Lakehead nursing and they want 2 shots at the 2 different streams, they apply to both. So that's one option, but no, you don't have to apply to both.
Thank you. Hopefully that cleared up that question for the one in the audience. One question that we do get actually in recruitment that I haven't noticed that has been asked yet is, do students applying to the program have to take Casper test or any sort of pre-tests to enter the program?
No, some schools of nursing do have different tests, for example, like the Casper test that they run as part of sort of their admission criteria to narrow down their pool of applicants based on other factors beyond just their transcript. At Lakehead, we have just the normal, simple transcript-based admissions process where we're looking for the presence of those prerequisites that we talked about under admission requirements, and as well your average. So we just look to make sure you have all the courses that you need, and then from there we extend offers to the students who have those courses and who have the highest averages.
Awesome. So it looks like that's all of the questions so far, but I'm sure that there's probably going to be a bunch more that do end up coming in. Oh, I do have another one that just came in. Is it too late to enroll for fall 2022? And we're probably all going to shake our heads and say, no, it's not too late to enroll for fall 2022. Applications are currently open, so you are able to still apply into the program for next fall.
And I'm noticing the one question that says, are you able to speak on life in Thunder Bay? So if there's any more specific question related to that, certainly fire that in the chat. But in the meantime, just one thing I wanted to comment on is that Northwestern Ontario right now is starting to really feel the nursing shortage that we project is only going to get, unfortunately, a little bit worse in the years to come. So it's a good place to come to for nursing school. We have a lot of opportunities for nursing students and graduated nurses here in Northwestern Ontario. And I know that's the case certainly for other places as well. We're not the only ones experiencing that right now. But I just wanted to throw that out there, that it can be a good chance to have some placements in places that are absolutely hiring and are actually very keen to make sure our students have a really good learning experience, because they're hoping to recruit them as employees when they graduate. So that's one thing I wanted to just throw out there, that that question made me think of about life in Thunder Bay. But certainly if you like outdoor activities and you like a bit of a smaller town, Thunder Bay can be a really good place for you. Some people want a break from a bigger city or want to try something new, but there's lots of wonderful outdoor things to do in Thunder Bay. So a lot of students certainly enjoy that. And many of our students that come to Thunder Bay to Lakehead for school end up staying here after they graduate, in part because they've been heavily recruited by the places they've done placement. And certainly there's some even bonuses these days for nurses to work in areas that are understaffed. So, yeah.
Perfect. Thank you. So doesn't look like we have any more questions coming in, but there are still some recruitment things that I do want to touch on before we end the presentation. So definitely keep your questions coming in. I do want to mention all the different opportunities that we have going on. So wanting to learn a little bit more about Thunder Bay and about Lakehead, we have our All About Lakehead sessions that we do host twice a week on Mondays and Thursdays through our upcoming events page. So students are definitely able to join those. It's recruitment that puts them on. So we're happy to answer any questions that you have about either of our campuses actually, and about both of our cities as well. You also learn a little bit more about different student supports that we have going on and things like that. We have an open house that's also coming up in December. And so you have the opportunity to, I'm not sure if Caroline and Catherine are part of that on a booth, but I see some nods. So you're definitely able at some point, if you forgot to ask any questions along the way, you thought of something after this presentation, you're definitely able to join our open house through our upcoming events page. It should be on there. Register and pop into a booth, check out the presentations that we have going on, talk to student supports. If you have an IEP or anything like that coming from high school, we have our student accessibility services, and they can definitely help out with accommodations, letting you know what might be in place. There's residence that's going to be there as well. So anything that you need to know about entering the nursing program and sort of all of the other things that happen as you become a student at Lakehead as well. There's tons of opportunities to connect with your future faculty or your future residence advisor and things like that. So I am going to put a link to our events in the chat in a sec here. We do have a couple more questions that have come in. So somebody is asking, are admissions for the nursing program competitive?
So they are competitive in the sense that how we define competitive programs in universities where we have more demand than we do supply. So there are more applicants than the number of seats that we have in that program. So yes, absolutely, nursing is consistently a competitive program where the number of applicants to number of seats might run around 5 times the number of applications for number of seats. So that's an arbitrary number that definitely depends a bit on different factors each year. And as we're experiencing a nursing shortage, perhaps, and hopefully we'll have lots of applicants this coming year and in the years to come, but that doesn't necessarily mean that is the case. So we certainly encourage everyone to apply. And if you're in high school right now, do your best to keep that average up as high as you can for whatever program you're applying for and for whatever school. And nursing programs across the board tend to be pretty competitive. So that's a good thing to do, is try as hard as you can in high school to keep that average up. And that also does prepare you to be a really strong student in university. So it's a twofold benefit there.
Perfect, thank you. So do you have another question that came in? I love that there's more questions coming in. I think that I'm going to move to the next kind of topic in our presentation. I see another one pop up. Is the nurse practitioner master's program offered at Lakehead? If not, what does the master's of nursing program offer after you're done?
Very good question. I love that. So students can come into, so after your BSCN, if you're going into a straight pure master's, you don't necessarily need to work for any number of hours or years before applying to that master's program. You can come directly into a master's program after completing your undergrad, or at least you can apply to one. You're eligible at that point. For nurse practitioners, though, you have to work for about 2 years before you're eligible to apply for a nurse practitioner master's program. The nurse practitioner programs in Ontario all became paired with a master's program many years ago. So nowadays, when you apply to a nurse practitioner program, you're applying to a nurse practitioner master's program. So it's 2 things in one. So you graduate with the ability to write the NP exam, and you also graduate with your master's degree. But you can also apply to a pure master's nursing program, and then we don't see that same work requirement beforehand if you plan to go straight into graduate school after your BSCN. But both of those doors are open to you as a graduate of a BSCN program. And yes, Lakehead does offer both of those options. Good question.
Thank you, Catherine and Caroline. We are starting to get more questions about students sort of wondering, their future after nursing and further studies and it is really wonderful that we also offer grad studies. We just don't have too many answers on them for undergraduate recruitment, but really glad that our faculty does for those programs. So while we wait for some more questions to come in here, I am also going to mention that we have started in-person campus tours. That was a question that did pop up, and I did provide a link for that to the audience member who did ask, but we have started our campus tours that are in person. We are able to finally welcome prospective students and their families onto our campus. So I will put the link for our campus tours into the chat here, just so you're able to check it out, check out our campus. You get to see residents. We are offering tours of residents, tours of all of our buildings as well. We do point out our nursing labs along the way. So it is a really wonderful experience where you get to see sort of where you're going to be studying and try to imagine yourself walking from class to class or to the main cafeteria or anything like that as well. So another question that came in here, can you get jobs with only an undergraduate degree in nursing?
In nursing, absolutely. The jobs are aplenty for a student with an undergraduate in nursing. So as I mentioned earlier with that slide on the NCLEX, the BSCN, the Bachelor of Science in Nursing, is the undergrad that gives you the ability to write that licensing exam that is the NCLEX, and that is the national licensing exam for all of Canada. And it's kind of bigger than that because it was historically and still is the licensing exam for the United States as well. So students write that NCLEX exam once they've completed their BSCN, and then they're officially a registered nurse working for some province or wherever they're working. And then on you go. You can apply for any of those many available jobs across the board that are looking for a registered nurse. So if you're looking at nursing as potentially your degree for your university education, if you don't believe me, certainly have a look around on some career posting websites to see all the many jobs out there for a registered nurse in all the many different areas. And that will give you a very good sense of all the places that nurses work and all the many jobs that are out there for nurses.
I do have a question that hasn't been put in the chat, but to help kind of continue our conversations, if a student completes the program in Ontario, can they apply to a job in BC? Is there any sort of additional work that they have to do, any courses, any sort of extra exams or anything like that that they have to complete?
You know what, things in Canada for nursing programs are designed quite well in that we're all accredited by the same Canadian Association of Schools of Nursing. So that's one piece of it. So that's good. And it keeps us all on the same level in the quality of education that we deliver and how we prepare nurses. From there, once you graduate, you can apply to any College of Nurses within any province or territory or even outside Canada. And then from there, that's how you process your licensing at the time of your program completion. So yeah, there's very little red tape within Canada and also very little even beyond Canada. So there's some legwork the students have to do, of course, for applying for nursing jobs outside of Canada, but within Canada, it's really smooth. So you can apply to, and again, if you don't believe me, have a look at the College of Nurses website for whatever province it is you're looking at and look at their eligibility criteria and how easy it is to apply for licensure within their province after graduating. And so there's sometimes some really good information on their websites, but yeah, that happens quite smoothly within Canada for sure.
Perfect. So it doesn't look like any questions have come in since then. So I'm going to touch on a few more recruitment things just to see if anything else comes through. So I did want to mention some important dates coming up. So for anyone who is a direct from high school applicant, so if you're in grade 12 right now, you're looking to apply to the nursing program, You must apply before January 13th. That is the deadline for applications for equal consideration. So definitely apply before January 13th. Do not apply at 11:59 p.m. on January 12th. Definitely mark that date in your calendars. Set yourself reminders and make sure that you're applying before that deadline. So just to make sure you have the best chance of receiving an offer if you meet those admission requirements into the program. I did see that Catherine did put her email into the chat as well. So for anyone who was looking at contacting her after this webinar, wanted to copy it down, if you had a question in a month or so, I'm sure that she'd love to still answer your questions. But definitely copy down her email if you have any program specific questions. You don't have program specific questions, you just kind of want to know a little bit more about Thunder Bay or our campus. You're looking for how to book a tour. I did put the link into the chat as well as our upcoming events. But if you missed those links or you didn't copy them down or anything like that, you can definitely shoot us an email at our general recruit email, and we will be happy to guide you along the way, put you in touch with Catherine if you forgot to copy down her email as well. And Caroline just put her email in there as well. So definitely, again, copy those down. They are definitely great resources to have if you have any questions about our nursing programs. So it doesn't look like we have any more questions that have come in since that last little spiel that I did. So Caroline and Catherine, thank you so much for joining us this evening. And thank you everyone in the audience for all of your wonderful questions. It was really wonderful to keep that conversation going and answer all of those questions that we sometimes get in recruitment, but it's really wonderful to be able to have our faculty here to be able to direct a lot of those as well. All right.
Thanks
So
everybody for joining.
Yes, thank you. We hope to meet you in person one day on our campus.
Thanks everyone and have a wonderful rest of your evening.